Hello, welcome back to my channel. My name is Nikita D and I have a little video for y'all today. So as some of y'all may know, I am an ultrasound tech. I've been doing vlogs about being an ultrasound tech and my journey, and a lot of people ask questions in the comments or reach out to me on Instagram asking questions, and I'm always happy to answer all your questions. So if you want to ask me questions, I'll put my Instagram down below, or if you have questions after this video, please feel free to comment. But a lot of the questions people ask are very similar, so I decided just to make this video like a little Q&A or just a rundown on my experience from starting school to now on being a tech and everything that you basically need to know to start. So let's get started. What is an ultrasound tech? Ultrasound tech is somebody that takes diagnostic images for a doctor. So an ultrasound tech is most commonly known to take pictures of babies. So when you're pregnant, you come in and you want to check the baby, know the gender, or check to see if the baby's okay. You come in and you get an ultrasound and you get some pictures and you see if the baby's okay. But there's also a lot of different other ways that we use ultrasound. We use ultrasound for a lot of the organs in our body. So there's general ultrasound, which does liver, kidney, pancreas, spleen, gallbladder. You could check your thyroid, you could check your testes. You do vascular ultrasound, which is all the veins in the arteries, so you could check for stenosis or aneurysms or blood clots. They also do echo, which is for your heart. You're checking your heart. We do MSK, musculoskeletal ultrasound as well. We do OBGYN, which is what's most commonly for, so anything with your uterus, ovaries, reproductive system. We also do breast, where we check for screenings or diagnostic, check for breast cancer or cysts or whatever else is in the breast tissue. So there's a lot of different uses for ultrasound, a lot of different specialties you get into. So a typical patient that I will get, I will have a schedule. I work at an outpatient facility, so I have a schedule of the patient that's coming in. The patient comes in, there's a script from the doctor saying what test they should get and why they have an exam. So it could be a complete abdomen study, and the script says that they have elevated LFTs, so they want to check their abdomen. They come in, I get the patient, I ask them, why they're here, because sometimes their reasoning is different from what the doctor's reasoning is. If they have any pain, do they have any history of surgeries, or try to get some background information from the patient. I also look at the exams that they did prior, if they have any prior exams that they did, to see if there's anything that was found before. And then I take the exam. We have a protocol, a list of images that you have to take, and you take those pictures, and then you write a preliminary report, or just say what you found, say if everything's normal, or if you see something, you put it in your notes. You write notes, and then you send it off, and then the radiologist is a doctor that reads it and gives an official report and interprets the images that you take. So that's what we do. So let's talk about how we become an ultrasound tech. There's a lot of different ways to become an ultrasound tech, but you have to go to school for it. There's schools that's like a 4-year school that you go to school for 4 years for. There's schools that they want you to have 2 years of prerequisites, and then you go to their school for 2 years. There's schools that want you to have a degree, and then you go to their school and you get a certificate. So there's a lot of different ways. You just have to look up the schools in your area and see what they require. For me personally, the school that I went to was New York Medical Training Center. I'm not recommending the school. There's a lot of pros and cons to the school that I really don't. I'm not going to get into that in this video. But that's the school that I went to. I chose that school personally because the tuition was lower than other schools that I saw, and I didn't need a specific list of prereqs. They wanted you to have a degree in a health related field, and there's a reason why different schools have different prereqs. When choosing a school, you want to look at a couple of things. First is accreditation. So accreditation just is something that the school gets that makes it official. And when you graduate from this school that's official, you can take the test that you need to take to be a registered ultrasound tech after you graduate the school. The school that I went to was not accredited, but I was still able to take those tests to become licensed because I had a bachelor's in a health related field. So I qualified to take the test right after school. Whereas if you didn't have a bachelor's, there's different ways you could still get around to taking a test. You'll have to work for a certain period amount of time to take the test. I'm going to get into testing and getting registered later on in this video. Another thing you want to look at when choosing a school is the specialty you want to get into. So there's a lot of different specialties and things you can get into in ultrasound. Some schools, they teach a variety of them. Some schools teach all of them. Some schools, they want you to choose which one you want to do before you start and you stick on that path. I would recommend going to a school that does many of them so that you could always have that option. If you learn abdomen and vascular and OB, you could have the option to pick whichever one you want to do and pick whichever test you want to take. Or if you think that you would like OB and you realize after going to school you didn't want to do OB, you have something else that you can do. So I feel like personally the more things you learn, the better for your choosing, because at the end of the day I could work in OB for 10 years and if I want to switch into something else, I still have the option to because I learned how to do so. So yeah, and please read the reviews of the schools that you want to go to. Okay, listen to what other people have to say about the schools. I've heard very bad things about a specific school. I don't know how to pronounce the name. I'm going to put the name up here. It's a school in Brooklyn. And I heard very bad things about them. I heard that they don't try to help their students. They have this type of mentality that if you can't pass the class or pass the test on a first try, then you just don't belong in the field. And they will literally kick you out of school without trying to help you pass or get into without helping you try to succeed, and they will take your money and you still would have to pay for the tuition from you being there. And I heard also that they're very picky with who they choose to do this to. The people that look more like them, they don't do that to, whether they're failing or not. The people that don't look more like them or not from their ethnicity, they would kick out. So be very careful on the schools that you choose and just look up what's in your area. Okay, schools have different requirements to get into them. Some schools you have to do an interview for. Some schools you just have to have the prereqs. The school that I went to, it wasn't nothing too crazy. Like I did an interview, the director asked me a couple questions, and it was really a type of thing where as long as you qualify, you're probably going to get in. Where other schools are more selective and there's a whole process in applying and a time period that you have to wait to see if you get accepted, and a certain amount of students that they accept. Some schools are more restrictive and picky with their students. So once you go through all that and attend school, this is how it's going to be. Different schools are different, of course. So the school that I went to, we had different modules. So when I first got there, the first class we took was anatomy and physiology, and we took that for about 3 months. That's it. From 9 to 3 every day for 3 months we did anatomy and physiology. And then once we were done with that, we went to OB for like another 3 or 4 months. We did OB. The school I went to was a 2-year. It took about 2 years to complete. And so for that amount of time we did OB, and afterwards we're done with that, then we do abdomen. And afterwards we're done with that, we just went through we went through each of the things we had to go through, the classes that we went through. Different schools are different. Some schools you will have to take a lot of classes all together, like how a traditional college would be. There's also different classes. So there's the physical class that you take, like a regular college class. You have a professor and it's a lecture. You have the lecture class, and you have a lab class where you're doing the physical hands-on scanning. Both of them are equally important. You have to know what you're seeing, know what's normal, abnormal, know the pathologies, know the anatomy, and doing the hands-on, you're going to have a better understanding of the lecture, and you're going to gain your muscle memory for when you're scanning to take the best pictures. The school itself, for me personally, wasn't too hard. Everybody's different. It depends on what school you go to. It depends on what person you are. I have a bachelor's in biology, so a lot of the classes I took in college was extremely hard, and I didn't even know how I passed, honestly, but that's besides the point. Saying that to say that I took a lot of hard classes, so classes that I take after that, like I compare it to that, and I'm like, okay, that's not as hard as those classes that I have to take, so it's not hard to me. So to me, school wasn't hard. It was very challenging, but it's not something that cannot be obtained. I feel like anybody can be an ultrasound tech if you really just put your mind to it, and it's a lot of information to take in. Like, it's a lot of information to take in. Each specialty, each class is a lot of information to take in. You have to learn about the whole entire body, all anatomies, all the functions, all the things that could go wrong. It's a lot, but you just have to find the best way for you to study the material and learn, and I think that you will be okay. It's always a learning process. Even if when you get out of school, you will still be constantly learning. After you finish with the school part, so I keep saying this, but different schools are different. The school I went to, we did the lectures and the labs, and we did all our classes, and then we got sent up to clinicals. Clinicals is an internship where you work in a hospital or a center where you do ultrasound, and you intern as an ultrasound tech. Some other schools, they do it while you're taking the class. So if I'm taking an OBGYN class, some days I'm in class, some days I'm in a hospital on that rotation, an OB rotation, and I'm doing my internship while I'm taking my lecture. So it's different for different people, and there's pros and cons to both ways. In my case, I took it after, and it was nice because you learn everything already. But then again, I was in school when COVID first started, and it was very hard getting an internship. So you kind of just took what you got. We waited months to get internships because you could imagine it's COVID. Nobody wants an extra person, unnecessary person next to them, leaning over them, watching what they do, and it's just unnecessary, right? So it was really hard to get an internship. But when you do, you get to a place, you want to complete your hours so that you don't have to wait any longer. So sometimes you get matched with things that you don't want to get matched with, and you don't learn as much as you can. In my experience, I got matched with a vascular lab, and I like vascular. I am a registered vascular tech. So I fell in love with vascular because of that internship, and then I did a general internship after that as well to complete my hours. But the schools that usually do the internships while you're taking the classes, you're going to do each modular with the exam. You're guaranteed to do it like that. So I assumed that I was supposed to be able to get experience in breast or get experience in OBGYN, but I didn't get that experience when I was in my internship. But other students that went to other schools and they do their internships while they're taking a class, they're doing their vascular internship while they're taking a vascular class, it worked out better for them in that way. But also, some students told me that because of that, they didn't have the knowledge because they didn't learn a lot of things yet. So they're now starting a class, and then they're in a hospital, and the doctors and the other techs expect them to have a certain level of knowledge or know things, and they didn't, and they felt more embarrassed because they didn't know as much. and they didn't get enough time to learn it before they got into that setting. So there's pros and cons to both ways. Clinicals is a hit or miss. A lot of places, you're an intern, you're filling gel bottles and watching them scan majority of the time. They don't really want to take a chance for you scanning real patients. You might get a chance to scan here or there. And some places, they just throw you into the water and you either sink or swim. In my experience, the first internship I had, I was at a hospital. It was very slow because it was like COVID. Like, it was slow. A lot of people didn't want to come into the hospital, but we had inpatients and outpatients, and it was a vascular lab. But some days we had 10 patients, some days we had 2 patients. So majority of the days was very slow. So I was allowed to scan a lot. Like almost every patient that came in, I was allowed to scan. Especially when I was first there and I was the only intern there. Later on, other interns came. But it was very intimidating and scary because the first day is like, we're doing rule out DVT and she's like, okay, I done this. This is the first leg I did. Here's a probe, you do the second leg. This is the first patient I'm seeing in a clinical setting. You want to scan legs already, like, you know? So it's going to be different depending on the tech, depending on the place. It's going to be crazy. The second day I was there, she was like, do this patient, take the first 5 images and call me when you're done. I didn't know what I was doing. This was COVID time. A lot of the classes I took was online. Vascular was one of those classes that I took online, like during Zoom. And we didn't get much scanning time because of all the restrictions of how much people could be in a room and ventilation and all this stuff that was going on. So I wasn't scanning as much as I did other things like with vascular, and it was harder for me to learn over a screen rather than being in class. So I didn't know a lot of things, and I'm just there like, I'm taking forever to take these pictures because I don't know what I'm doing. It's basically, that's it. I didn't know what I was doing. You're gonna be very humbled at your clinical experience, but every experience is different. But at the moment, I didn't know what I was doing. And it's like, the tech that was with me, she's like, you gotta do it. She left. That's it. I'm there with the patient alone, struggling to take these images. It was a lot. And then she would come in 30 minutes later. She was like, are you not done with these images yet? She's like, okay, what's wrong with this image? And I wouldn't know what she's talking about because I don't know what I'm doing. She would just be like, you're gonna fix this, I'll be back. That's it. So some people, you just gotta figure it out and learn like that. And some people, they'll take you step by step, hold your hand until they feel like you're ready. It just depends on who you get. You're gonna get different people. That's the point of going to different internships. You're not gonna be stuck at one place. Some people are, because some places do a wider range of exams, and some people, they go to multiple sites. If you go to a place with multiple people, you'll probably get paired up with different people and they have different ways of teaching, or you go to different places. But yeah, you're basically going to be doing the job of what you're going to be doing when you're done school. You're going to be scanning and they're going to teach you, and you're going to learn a lot. You're going to learn a lot. So all you have to do is listen to what they say, try to remember, take notes, remember everything. It's going to be a lot to take in. It's going to be a lot to take in. It's going to take time to remember all those stuff. Sometimes you work with different techs and they like things different ways. They're like, oh, why is the picture like this? It's like, oh, this tech told me to take a picture like this. You're telling me to take a picture like that. This tech telling me to position the patient like this. This tech telling me something different. So you just kind of have to remember. Also, don't be on your phone. I think that's obvious. Like, don't be on your phone if you don't have to. When you're on break, be on your phone. But even if it's slow, you could be studying. You're studying, you'll have registries to pass, you're learning new things, you're trying to remember things. There's always work to be done. There's always studying you could be doing. So do that and try to make a good impression, because a lot of people get jobs after the internship. The people hire them, they get offered a job at your internship. I did 2 places. I did the vascular lab, and I went to a clinic, like a doctor's office, and the general there. The doctor's office was very busy and I barely got a chance to scan over there. So needless to say, I kind of fell in love with vascular because I got a lot of experience from the hospital, and by the time I left, I was scanning every single patient I passed by myself. They wasn't even checking what I was doing. They offered me a job there, but I had to be registered but I had to be registered, and I was still a student at that time, so I didn't have my registries yet. I didn't do my exams. I didn't even do my SPI yet. I'm going to talk about exams later on. The school that I went to, they had, I do for 800 hours. I don't know if that's for every school or school has different hours, but 800 hours. You could do full-time or part-time depending on you, depending on the place that you get. It's a lot of depending on, but yeah, I did full-time. I tried to finish as fast as I can. Some people, they don't have the luxury of going to clinicals for 40 hours because you have bills to pay and kids to take care of, and you need to work also. So it takes different times depending on your situation, and depending on how long you have to wait for the clinical sites, it's gonna take different times. I expected to finish school a lot earlier than I did because of waiting for clinical sites. So let's talk about exams. So to become a registered vascular tech, you have to take at least 2 exams. Before I even start with that, the company that you're taking these exams with is called ARDMS. ARDMS stands for American Registry of Diagnostic Medical Sonography. They're the company, the organization that you'll be taking your test from. There's different organizations that you can get registered from, but this is the most popular, and this is what most employers look for, to be registered, to have registered from ARDMS. Okay, so to be registered with ARDMS, you have to take 2 tests. They take your SPI. Your SPI is Sonography Principles and Instrumentation. That's what SPI stands for. This is physics. It's just straight physics. So when you're doing ultrasound, you're gonna have a class just physics. The physics is not the physics that you learn in high school. It's about the machine. So ultrasounds are sound waves. You learn about the sound waves. You learn about how the machine works, the probes, the frequencies, the amplitudes, everything, like the Doppler, the reverberation, the artifacts. There's going to be a lot of formulas that you have to remember. There's going to be a lot. It's going to be math and conversions. So it's physics. You have to understand the machine, how the machine works, how to use the machine. Basically, that's a whole test of its own, which is a physics exam, which is hard for a lot of people. So yes, the SPI is a test on its own, doing all physics and everything about the machine. So you will have to pass that test first. You could take the test right after you take the class in school, or I waited because I took the class online and I just felt like I wasn't ready. So I waited until after my first internship, in between my second one, and I took it and I passed. So that's the first test you have to take. After you take that test, you have a second test. You're gonna have to take a test based on what specialty you want to get into. So the second test, you have to wait until you completely finish school to take the test. And if your school is accredited, you could take the test right away. If your school is not accredited, you would have to, and you don't have a bachelor's, you would have to work for a year before you could take that test. Okay, so the tests that they offer are the breast registries, the general, which is the abdomen, the OBGYN, the echo, the vascular, the MSK. I think there's more, but those are like the most popular ones, right? And yeah, so these tests is around 100, and the vascular test, I'm registered as a vascular tech. It's like 180 questions. You have 3 hours to take them, and you have to pass that test to officially become a registered tech, right? Some places, they don't care what you're registered in. As long as you're registered, they'll hire you. Some places, they want a specific registry. That's really up to you to decide if you have the choice to choose which one you want to do. Some people say breast is the easiest one to do. I don't know. I haven't taken that one yet. So if you don't pass on the first try, that's completely okay. Most people don't pass on the first try. There's people I know that take the SPI 5 times. There's people that take it more, to take it 9 times. You just keep going until you pass. Of course, it's money. It's like $250 every time you take the exam, and once you take it, if you fail, you have to wait 2 months to take it again. But you just have to keep going. For the vascular exam, I took it 3 times. Okay, the first time, these tests you have to get a 555 to pass out of 700, I believe. The first time I took it, I got a 505. I waited 2 months to take it again. I got a 535. And then the third time I got a 6 something. I think like 620 or something. So I think why I didn't pass the first 2 times is the material that I was using. The book I was using, I used the same things for the first 2 times, and I switched it up and I started using Ultrasound Register Review, which is a website. I'm going to link it. And they have all these review courses, and they have practice tests as well. So I think that really helped me, because I feel like those questions and how they ask the questions were a lot very similar to what was on the exam for the vascular test. For the SPI, I like the Penny book and the Davies book for the SPI. And I use the Edelman book as well. So yeah, once you pass the SPI and any one of those specialty exams, you are a registered ultrasound tech. And then after you're registered, you have to keep up with your CME credits. Your CME credits keep you registered. So you have to have 30 credits every 3 years. And to keep those credits, there's multiple things you can do. You can take practice exams. You can visit like lectures or different things to keep up those credits. But what you also can do is you can keep taking multiple tests. So each test is worth 15 credits. So you can take 2 tests within the 3 years and pass those 2 tests, and you kept those CME credits, right? So that's what a lot of people do, because once you pass more tests, you're getting more knowledge and you're registered in multiple things, and it's easier to get a job because you're registered in multiple things. And once you keep getting more registries, a lot of people just raise your salary, and you could ask for a raise that way, or you could do different things and you just have more knowledge and have more registries under your belt. So I'm RVT, which means that I'm a vascular tech, and eventually I'm going to do something in the more general field so I could get my RDMS, so I could be a registered diagnostic sonographer. Right now I'm a registered vascular technician, right? We're still ultrasound techs. It's just a different title, but I would like to have both titles. So to be a registered diagnostic sonographer, to get that title, you have to do either the OB, GYN, the general, the breast. And for the vascular one, you have to do vascular. There's a different title for the echo one. I don't do echo, so I can't give any information for the echo one. Once you pass your test, I think there's a yearly fee that you have to pay to stay registered, like a membership fee or whatever. And then you get like a little card with your ARDMS number and everything like that. So yeah, you just have to study, keep going. If you fail, keep going. For the people that can't take the test right away, you're gonna have to find a job. I found a job. My first job, I wasn't registered, and I found a job. It's going to be harder to find a job if you're not registered. And also their experience level, because a lot of people, they want to see experience outside of internships. Some people, they will hire you right out of school. It's sometimes luck and chance, and you just have to persevere and keep looking. Don't get discouraged when you don't find a job. You just have to keep applying. Apply to a million jobs a day. Apply to everywhere. When you just got out of school, it's like you can't really be picky. You have to apply anywhere. You're going to get a shitty job. Your first job is you're not going to like it. I mean, you can. Some people get lucky. Some people, they get offered right out of the internship, and you already accustomed to everybody, you know everything, right? I got a job offer right out of the internship, but I had to be registered, and I took over a year to pass all my tests. So so I got, so it's like, you know, I couldn't take that job when I was offered it because it took me forever it took me a while to get the credentials I needed for the job. But your first job is not going to be the most ideal job. You just have to keep going until you find something that you like and just take it. The first job I took, I didn't like it at all, but I took it because I needed some experience in the field so that I could get the job that I have. Things that a lot of people don't talk about with ultrasound as well is ergonomics. Ultrasound has a high percentage of work-related injuries with things like musculoskeletal disorders, like carpal tunnel, or, you know, shoulder injuries, back injuries, because you're pushing this machine sometimes to the hospital. Sometimes you have bigger patients and you're doing the abdomen and you're pressing. Sometimes my wrist be hurting me because I have a bigger patient and I have to press down to really get a nice image. Sometimes you're uncomfortable, you're standing in weird positions, so you can easily get work-related injuries. So you have to make sure that you practice good ergonomics so that you can prevent it for as long as you can, right? But we can talk about salary. So I'm from New York, New York City, so I only can tell you the salaries from around here. The salaries that I've seen, I've experienced, and I've seen that other people experience around. Seen new techs straight out of school get 30, or new techs get 35, and experienced techs get 40. It's like a range around that I'm seeing. Of course, the more experience you have, the more money you get. There's people that get 60 and, you know, or more. There's people that get paid per patient. They might get $60 per patient and they might do 15 patients a day. There's people that traveling techs. Some of them get paid $90 an hour traveling to a different place. So it depends on the place that you are. Clearly, you could really just Google that and look that up, or better yet, go on Indeed and just look up the jobs that they have out right now, ultrasound tech in Minneapolis, and see what their people are offering, the range that people are offering. Ultrasound tech in Seattle, see what they're offering and do it like that. But yeah, it's just like any other job. When you first get out, you don't have as much experience, you're not going to get paid the most. And when you get more experience and you pass more registries, you have more things on your belt, you get raises or you get paid more. So yeah, people get on the low range, especially if you haven't passed your test. People might offer you 25 or under, somewhere in the low to mid 20s. But just know that you just have to get past that hump and get your experience and go. Get your experience and go where the money resides. That's what you gotta do, okay? So yeah. Anything else I want to say? I don't know. I don't think so. This might be a very long video. If you have more questions, please feel free to write them down below. Feel free to DM me. My Instagram is Nikita Skye, NIKITASKYE. You can ask me anything there. DM me, follow me on TikTok, follow me everywhere, and you can ask me the questions if you have more specific questions, if you want to know more about the school I went to or anything. If you have any video ideas, leave them down below. If you want to see more vlogs, I don't know, just talk to me, okay? And yeah, thank you for watching the video, and make sure to like and subscribe, and toodaloo.